Having anxiety is like walking around with an umbrella waiting for it to rain. Assalamu alaikum and welcome back to my channel, Your Psychologist. Today I would be talking about anxiety and how we cope up with this anxiety during this pandemic. So let's start today's video. According to the recent reports, the rate of clinical anxiety in adults has been increased during this pandemic. While some have experienced clinical anxiety related to the more typical stresses of everyday life, such as their job, school, or relationship issues, many more others have experienced anxiety due to the rapid changes, uncertainty, and riskiness that accompanied the recent pandemic. But what exactly do we mean by anxiety? In our respective practices, we commonly evaluate and treat clinical anxiety disorders. Interestingly, however, we find that despite the high prevalence of these conditions, there is often a lack of awareness and understanding about them. How do we define anxiety? Anxiety is basically an apprehensive uneasiness or nervousness, often over an anticipated situation. When anxious people experience excessive worry, they may even have physical symptoms also, such as shortness of breath, sweating, or heart palpitations. Moreover, we deal with the clinical anxiety. Clinical anxiety is problematic if it negatively affects a person's ability to adequately function in important areas of life, for example, relationships, work, schools, activities, and is experienced frequently and intensely or out of proportion to the situation. Most of us have times in our lives when we feel stressed out, whether due to working late on a homework assignment or having a heated discussion with a family member or friends. People who are stressed out may describe feeling anxious, tired, or irritable. Overlap exists with feelings of anxiety and being stressed out. Clinical anxiety, however, is experienced more often, more consistently, and more severely than the stressed out feelings that can occasionally occur. So, now what causes anxiety disorders? Anxiety disorders often have a significant hereditary component, means that they tend to run in families. Additionally, environmental factors, for example, chronic stress, public speaking, socializing in crowds, change in job or career, can precipitate or worsen symptoms of anxiety. Moreover, anxiety disorders are often a chronic condition lasting for 6 months or longer. However, depending upon the cause, there are certain situations in which an anxiety disorders can be cured, for example, due to medical problem or self-limiting. Example is related to a specific event. So, is there any treatment for clinical anxiety? Yes, highly effective treatments exist for clinical anxiety disorders. As with other illnesses and clinical conditions, a healthy lifestyle, for example, adequate rest, healthy nutrition, regular exercise, self care, goes a long way toward helping you feel better overall, including emotionally. If necessary, clinical treatment interventions include various types of therapies, biofeedbacks are provided to the individuals. Moreover, a trained healthcare professional or a psychologist can help with evaluation and proper treatment. The important thing is to seek help if you are suffering from a clinical anxiety disorder. Moving towards the coping strategies, so number one is eat well balanced meal. It simply means that you do not skip any meal. Second one is get enough sleep. When you are stressed, your body needs additional sleep and rest. So you have to get enough sleep. Third one is talk to someone. Tell the friends and family that you are feeling overwhelmed and let them know how they can help you. Talk to the physician or therapist for professional help also. The fourth and the last one is maintain a positive attitude. This simply means that you have to make an effort to replace the negative thoughts with the positive one. I hope you learned a lot from this video. If you like the video, then do subscribe my channel and press the bell icon in order to get notification of my new video. Thank you guys.